Welcome to the pivotal gateway of understanding diabetes and pre-diabetes. Did you know that beyond just high or low blood sugar levels, there are critical emergencies every individual should be aware of? Stay tuned to arm yourself with knowledge and protect your health in this must-watch episode. Brief overview of diabetes. Diabetes is a condition where the body struggles to maintain blood sugar levels effectively. It comes in two primary forms: type 1 diabetes, where the pancreas fails to produce sufficient insulin, and type 2 diabetes, characterized by insulin resistance and eventual insulin deficiency. Both types lead to high blood sugar levels, hyperglycemia, that, if uncontrolled, can result in serious health complications. Let's explore this critical health topic together. Just a reminder that this video is strictly for instructional purposes, so if you have any medical concerns, consult your doctor. Number 1. Hypoglycemia, low blood sugar. Hypoglycemia, or low blood sugar, occurs when your blood sugar drops below normal levels, posing immediate health risks. This condition is especially common among those using insulin or other diabetes medications. Its symptoms can range from mild to severe, starting with early signs like dizziness, sweating, and a rapid heartbeat. As it progresses, you might experience more alarming symptoms, such as confusion, loss of responsiveness, or even seizures. But why does hypoglycemia happen? Several factors can contribute, such as skipping meals, over-exercising without adjusting insulin doses, or an accidental overdose of diabetes medication. For mild symptoms, quick fixes like consuming glucose-rich drinks or snacks can be life-saving. In severe cases, emergency treatments like glucagon injections or intravenous glucose are necessary. It's vital for diabetics to educate their close ones about hypoglycemia so they can assist in an emergency. Number 2. Hyperglycemia, high blood sugar. Hyperglycemia, or high blood sugar, is a common challenge faced by individuals with diabetes. This condition occurs when the body either doesn't produce enough insulin or can't effectively use the insulin it does produce. Symptoms of high blood sugar include increased thirst and urination, fatigue, and blurred vision. Prolonged hyperglycemia can lead to serious complications like diabetic ketoacidosis in type 1 diabetes or hyperglycemic hyperosmolar syndrome in type 2 diabetes. The causes are often linked to factors such as dietary choices, incorrect medication dosing, or additional stress. To manage hyperglycemia, it's essential to adjust medication or insulin dosage as needed. Monitoring blood glucose levels regularly, adapting dietary habits, and maintaining a consistent exercise routine are crucial steps. Number 3. Diabetic ketoacidosis, or DKA. Diabetic ketoacidosis, DKA, is a severe and potentially life-threatening complication, primarily occurring in individuals with type 1 diabetes, though it's not unheard of in type 2 diabetes. DKA arises from a critical shortage of insulin in the body. Without enough insulin, your body begins to break down fats for energy, a process that produces ketones. When these ketones accumulate in the body, they cause the blood to become acidic, leading to DKA. The symptoms of DKA include excessive thirst, frequent urination, high blood sugar levels, and the presence of ketones in the urine. If the condition progresses, it can lead to nausea, vomiting, abdominal pain, breathing difficulties, and a distinctive fruity odor on the breath. Immediate medical attention is crucial when DKA symptoms arise. Common triggers include infections, significant stress, insulin administration errors, or problems with insulin pumps. Treatment usually involves a combination of insulin therapy, fluid replacement, and electrolyte balancing to restore the body's normal acid-base balance. Preventing DKA is as important as treating it. This includes regularly monitoring blood glucose and ketone levels, especially during illness or if your medication regime changes. If you find this content beneficial, kindly like, subscribe, and enable notifications for ongoing nutrition updates. And I'll put some links down below in the video description. Coming back now to number 4. Hyperglycemic, hyperosmolar state, or HHS. Hyperglycemic hyperosmolar state, or HHS, is a serious condition most commonly seen in individuals with type 2 diabetes, although it can also occur in type 1 diabetes. It represents a critical state of severe hyperglycemia, often with blood sugar levels exceeding 600 mg per dl, coupled with extreme dehydration and absence of significant ketosis. HHS develops due to a combination of insufficient insulin and heightened insulin resistance. The onset of HHS is typically more gradual than other diabetic emergencies. Early symptoms include extreme thirst, increased urination, dry skin, and progressive lethargy. If not promptly addressed, these can escalate to confusion, hallucinations, visual disturbances, and even seizures. Immediate medical intervention is vital in managing HHS. Treatment typically includes extensive intravenous hydration to combat dehydration, insulin therapy to normalize blood glucose levels, and careful monitoring of electrolyte balance. For those living with type 2 diabetes, understanding the subtleties of HHS and seeking medical advice at the earliest signs is paramount for effective management. Number 5. Diabetic neuropathy. Diabetic neuropathy represents a group of nerve disorders caused by diabetes. This condition affects up to half of people with diabetes, both type 1 and type 2. Over time, high blood sugar levels damage the tiny blood vessels that supply nerves, particularly in the legs, leading to neuropathy. The most common type, peripheral neuropathy, primarily affects the feet and legs. Symptoms may include pain, tingling, or numbness in these areas, potentially leading to serious complications if unnoticed or untreated. In more advanced cases, individuals may not feel temperature changes or pain due to injury, increasing the risk of unnoticed harm. Diabetic neuropathy can also affect autonomic nerves, which control internal organs, leading to issues like gastrointestinal disturbances, urinary tract problems, and cardiovascular irregularities. Treatment options may include medication to relieve pain, physical therapy, and interventions like regular foot care and checkups to prevent complications. Number 6. Diabetic retinopathy. Diabetic retinopathy is a critical eye condition directly linked to diabetes, where the retina's blood vessels are damaged due to prolonged high blood sugar levels. This condition is a leading cause of blindness in adults and a major concern for individuals with both type 1 and type 2 diabetes. The retina is essential for vision, capturing and converting light into neural signals. When affected by diabetic retinopathy, this process is compromised, leading to visual impairment. In its early stages, diabetic retinopathy might not present noticeable symptoms or only mild vision problems. The condition can progress to a more severe stage, potentially leading to significant vision loss or even blindness. The longer a person has diabetes, especially if it's poorly controlled, the higher the risk of developing this eye complication. Medical professionals' recommendations. Regular eye exams are crucial for early detection and timely intervention. Treatments may include laser therapy, vitrectomy, and injections into the eye, depending on the severity. Number 7. Diabetic nephropathy, kidney disease. Diabetic nephropathy, also known as diabetic kidney disease, is a serious complication of both type 1 and type 2 diabetes. It's caused by long-term damage to the small blood vessels in the kidneys due to high blood sugar levels. These kidneys are vital organs, filtering waste products from your blood and regulating fluid and electrolyte balance. When they're impaired, it can lead to significant health issues. In the early stages, diabetic nephropathy may not present any symptoms. However, as the disease progresses, one might notice swelling in the legs and feet, fatigue, and an increased need to urinate, especially at night. Regular monitoring of kidney functions is crucial for people with diabetes. This includes tests for protein in urine and checks on kidney function through blood tests. Quitting smoking and minimizing other risk factors are also important steps. Number 8. Cardiovascular complications. Cardiovascular complications are a significant concern for individuals with diabetes, as the condition markedly increases the risk of various heart and blood vessel diseases. This includes coronary artery disease, heart attack, stroke, and atherosclerosis, a condition where the arteries harden and narrow. The connection between diabetes and cardiovascular disease lies in the damage high blood sugar levels can inflict on blood vessels and the nerves that control the heart. People with diabetes are also more likely to have other conditions that contribute to heart disease, such as high blood pressure and cholesterol levels. Symptoms of cardiovascular complications can range from chest pain, angina, shortness of breath, to more severe manifestations like heart attacks. Prevention and management of these complications involve a multifaceted approach. This includes rigorous control of blood sugar levels, regular monitoring and management of blood pressure and cholesterol, and lifestyle modifications. A heart-healthy lifestyle encompasses a balanced diet, regular physical activity, maintaining a healthy weight, and quitting smoking. Molecular components and treatment. In the treatment of diabetes, a deep understanding of its molecular components is crucial. The cornerstone of managing diabetes, particularly type 1, involves insulin, a hormone produced by the pancreas that regulates blood sugar levels. In type 1 diabetes, the body's immune system attacks and destroys insulin-producing cells, leading to insulin deficiency. Here, treatments involve administering insulin, such as insulin glargine or insulin lispro, which are designed to mimic the body's natural insulin patterns. For type 2 diabetes, where the body becomes resistant to insulin, treatment focuses on enhancing insulin sensitivity and reducing glucose production. Metformin is a commonly prescribed oral medication that lowers hepatic glucose production and improves insulin sensitivity. Another class of medications, sulfonylureas, for example, glipizide, stimulate the pancreas to produce more insulin. Thiazolidinediones like pioglitazone work by increasing insulin sensitivity in muscle and fat tissues. Additionally, incretin-based therapies have gained prominence. GLP-1 receptor agonists, for instance, slow gastric emptying and enhance glucose-dependent insulin secretion. Understanding these molecular mechanisms is fundamental for tailoring effective treatment strategies. Every patient's journey is unique, and so is their treatment plan, reflecting the complexity and personalized nature of diabetes care. If you're as eager to learn about managing diabetes as I am, don't miss this opportunity. Tap the screen here for essential tips and insights on diabetes care. Thank you for joining us on this journey to 8 shocking diabetes dangers revealed. Embrace health, celebrate life.